Hi, everyone. Welcome back. This morning, we're joined by Dr. Tamara Sheffield, the Medical Director for Community Health and Prevention, to talk to you about the importance of the flu vaccine. With everything that's been going on in the year 2020, we want to make sure we can give our patients the most information about what's going on, how you can get this flu shot, and why it's so important. Tamara, thank you so much for joining us. We really appreciate it.
Amanda, it's a pleasure. This is a topic I'm really excited to share with people.
I'm excited as well. The first thing I want to talk to you about is the importance. Why is the flu shot so important for people, especially in a year like 2020?
Well, as everyone knows, this year we are struggling with something very new with the COVID-19 virus. And influenza acts a whole lot like COVID. They're both respiratory viruses and they're very similar. And so because of that, people can get confused when they come down with influenza, whether they have COVID or influenza, and they will actually be coming in to get tested. And so we have, we have to kind of protect our healthcare resources. We need to make sure we are not having people needing to be tested, also needing to be treated for influenza when we really need to take the resources and treat our patients for COVID. Our hospital beds we need to save for COVID patients, not for influenza patients. And just every year, it's important to get an influenza vaccine because people do die from influenza in this country, and we need to protect our most vulnerable individuals.
And you just talked about the fact that we have to protect our most vulnerable individuals. When you're thinking about going to get a flu shot, though, who should actually be getting a flu shot this year? Or in general, every year?
Yeah, so flu shots are approved for everybody ages 6 months of age and older. And we want to make sure that every person gets vaccinated, and especially those who are at higher risk. So small children, individuals who are age 65 and older, whose immune systems are getting older, they need to be immunized as well. And people who have chronic conditions. One other group that's really important to vaccinate is pregnant women. And the reason is when we vaccinate a pregnant woman, it both protects her. People who are pregnant have a higher risk of being hospitalized if they catch the influenza. But also there's that window of time that, 0 to 6 months when a baby can't get immunized. And the great thing is that this is how the way we were born to, the way we're structured to keep kids safe when they're first born is that moms have already developed antibodies and have ways to protect themselves from every infection they've been exposed to. And those antibodies that run around in their body actually pass over through the placenta into the baby to protect the baby. So if we give a flu vaccine to a mom in that third trimester, she develops antibodies and she can pass those on. So for those first month or two, the baby has protective antibodies in its most vulnerable time to be protected because their mom did the right thing and got vaccinated. So with every pregnancy, moms need to make sure that they get the flu vaccine.
And I'm assuming it's safe then to get the flu vaccine when you're pregnant. I feel like sometimes you may hear that it's not entirely safe if you're pregnant, but it sounds like it is. Why is it? You said it's very important, but how is it safe for pregnant women as well? What are some of the precautions maybe we take for that?
So the wonderful thing is we have a long time experience with the flu vaccine, and we've had pregnant women getting it for decades and have found that it's been studied and there is no risk of any untoward thing happening to the baby because of the flu vaccine. What we do know is all the benefits in terms of helping protect them from disease.
So you said COVID is a thing right now. We obviously know that the flu and COVID-19 are going to exist at the same time. Can you talk to us about the main differences between the two if I'm trying to decide which one I potentially have?
That's a great question. And again, they're spread very similarly through droplets in the air. And then those droplets can get onto surfaces. So very commonly with flu, we know that you can touch a surface where someone else who may have had the flu may have either touched or else the respiratory droplets have come. And then if you touch your mouth, your nose, your eyes, those are entry points for the virus to get into your body, as well as breathing it in, just like COVID. So that's how it gets into us. And then they act somewhat similarly. COVID is, of course, more severe in its symptoms, but you can have a fever. Both of them have fever, muscle aches, just feeling rotten and going to bed, a dry cough. That dry cough is something that happens both with influenza and with the COVID-19. We also see people getting the fatigue. I mean, just really tired as well. So those are kind of the things that you think of as the typical flu. Some people can get an upset stomach, the diarrhea and stuff, but that's not as common with either one. Now, the things that distinguish them with both can have a headache, but headache's a real common symptom with the influenza and not as much with COVID. But with COVID, what you get is that after you've had the virus for a few days, you get that shortness of breath where it's like, I can't get a breath, I can't breathe, and it's scary. And so that's something that we don't tend to see with influenza. And also that loss of taste or smell, that is a COVID symptom. We do not see that with influenza. Now, interestingly enough, with influenza, after having had it and you're getting recovered and you're feeling good, sometimes you can all of a sudden start feeling tight in your chest and start coughing up things that seem like you have green mucus or you're starting to cough it up. Well, the reason is that this is something influenza does that COVID doesn't. It paralyzes some of the cells in your lungs. These are the cleaning out cells, the ones that they act like a vacuum cleaner. They have these like brushes that pull junk out of your lungs. And because they're paralyzed from the influenza virus, then people get bacterial pneumonias afterwards. So that's one of the reasons why when we look at the death rates from influenza, we talk about influenza and pneumonia death rates, because a lot of those deaths come from that pneumonia caused by the influenza virus that then lets you develop a bacterial pneumonia. So again, if you have that kind of a symptom after influenza, you need to go back in and get medications from your physician. You need to be treated. So it's usually the shortness of breath, you can tell is with COVID is part of the illness when you're right in the middle of it. After your illness with influenza, if you start getting short of breath, that's probably a secondary pneumonia.
It also sounds like the loss of taste and smell could be a pretty good indication of which one you have. I know in the past when I've had the flu, I haven't lost taste or smell, I've lost my appetite. So maybe that's also a distinguishing thing you can kind of realize for yourself. But yeah, they're very similar and very close together. So it'll make for an interesting winter to kind of learn about how these two viruses kind of work together. Which brings me to my next question too. Why do we get a flu shot every single year? And do we have any sort of immunity from the flu if you've gotten it before?
Great question. Yes. So what we find is with the flu immunity, it tends to last, but not a full year. And the younger you are, the longer it tends to last. So, but older individuals need to have that priming boost. And we actually don't vaccinate them too early because we want them to have their prime immunity right when the flu season hits. So yes, your immunity to ones that you've had in the past does fade and needs to be boosted. But the other thing about influenza is that it's a virus that mutates really quickly, meaning that it's the progeny, the kids of the viruses are really mutant kids. They change the way they look and the way and it's the shape of their proteins on the outside of the virus. So our bodies forget and they can't recognize them and they can't fight against them. And so every year we look to see what's the newest mutant or drifted or shifted strain of influenza and develop vaccines that will target the ones that are circulating right now. And so as the vaccine, every year, the vaccine usually has a little bit of a shift and change to match what's happening with the new look and feel of the influenza viruses.
I'm sure that'll happen once we learn more about other vaccines too for other things. That you kind of every year things shift and change as you learn more research. And I want to talk about the effectiveness of a flu vaccine. How effective is it typically? So that when you go to get it, I know, and I've been told before that there's a window of period before the vaccine actually like not infiltrates, but that's the word I'm thinking of right now, like is in your system and actually can protect you, that you still have this window for a couple of days where you can get sick. Is that a thing? And then, yeah, how effective
Yeah,
is the flu itself?
great question. So when you, I'll talk a little bit about how it works, and then that can help understand a little bit about the effectiveness. So when you get the vaccine, either through your nose or injected into a muscle, it will develop, um, what you're presenting is something called an antigen. It's a protein that the body knows is not itself and wants to get rid of. And so it develops antibodies to attach to and attack that antigen. Now, it takes time for the body to do that. It's got to learn and have those antibodies grow. And so it takes a couple weeks before a person's really fully protected. And which has been interesting because people will say, well, man, I got the vaccine and then I got sick. Well, that's true. If you can get ill right after the vaccine because the vaccine may not be working. And you can also attribute just being ill to influenza. I did this one time where I had to go and educate a whole bunch of individuals at a facility about telling them, okay, your flu vaccine's here today, go down and get it. And I went through and talked to 100 different people. I didn't get the vaccine that day, but a bunch of them did. The next day, I was sick as a dog. I had a fever, I was in bed, and all of a sudden it's like, if I'd gotten my shot that day, I would have said, the vaccine made me sick. And so you associate that happening. Well, because we have these viruses running around at the same time we're getting the flu vaccine, a lot of times we'll say, well, I got sick. Oh, the vaccine must have made me ill, when it was actually another virus that did that to us. In terms of its effectiveness, we know that every year, it depends on how well we match that vaccine to what those newest circulating viruses are. And also the way we calculate it sometimes makes it look like it's not super effective. What we do is the way that they measure vaccine effectiveness, they go to people who've actually come in for medical care for a respiratory illness. So the people are already sick with a virus. And then they say, of those individuals, what's the odds that they were, well, first they test, are they influenza positive? If they're influenza positive, then they look to see what's the odds of whether they were vaccinated or not. That's the number that they get for their effectiveness. Okay, so usually it's about 40 to 60% every year is the number that comes up in terms of the odds that you will have been, that you are more likely to be sick if you didn't get vaccinated. And we can prevent about 40 to 60% of people coming in to see their physician with a respiratory illness. And then what we really are focusing on preventing is hospitalizations and deaths. And people who, we can prevent hospitalizations, about 40% of hospitalizations from influenza by getting vaccinated. But also once they're in there, the severity, almost 60% reduction in people who have to go to the ICU. And in terms of, no, it wasn't 60, it's actually greater than 80%. That's the latest research came out. So greater than 80% people we can prevent from having to go to the ICU. And then in terms of preventing deaths, if a person has to be hospitalized, it's in the range of about 50 to 70% reduction in deaths as well. So we're seeing an enormous help in having less severe disease, even if you do happen to get the virus.
And I feel like it's so important to understand that right now, with everything that's going on with COVID, we really want to prevent people from ending up in our hospitals because, like you mentioned at the beginning, we need those ICU beds for very ill COVID patients in case something were to happen, or if you are very severely ill from the flu, we need those beds. So as many people as we can get to get the flu vaccine will kind of help our healthcare workers and make it for an easier winter for us, which is my next question. Why is the flu only spread in the winter? Why is it not something that's year round?
Actually, it is year round. And so that's something that people don't really understand or realize. But we're in the middle of the flu season we can see 1,000 new cases of flu every day. During the summertime, I might see 3 to 5 cases a week. So influenza is there, but it isn't spreading through our communities. And there's a few reasons for that. One of them is we're inside and congregated all together during the winter seasons. This is where we're all together and we pass things. And so we'll talk a little about, I think later we can talk about how we prevent that kind of spread during this winter time when we're all closely inside of buildings and breathing the same air. The other thing, though, is it's the structure of the virus. It's really fascinating that this is something I get excited about. I don't know if other people do, but the virus actually, in cold weather, develops a hard shell around it. It's kind of like an M&M, you know, that M&M shell that they talk about. Well, when you get it inside your body and it gets warm, then that shell dissolves and it can infect you. But the other thing is it passes more readily from one person to the next with that when it has that hard shell. So it actually spreads better in cold. And so those are a couple of the reasons why we see winter time is the activity time for flu.
I didn't know that the flu was around year round. I just learned something. That's a really interesting analogy too about the M&M. I think that helps, that can help parents to kind of teach their children a little bit about what the flu is and how it can kind of get into your system. You mentioned prevention. This year or right now, we're majority wearing masks and we're taking proper precautions for COVID-19. What are some precautions we can take to prevent ourselves from getting the flu right now?
So this is the thing that's going to be helpful. The fact that we are trying to prevent COVID, which is a respiratory illness, we can use some of those same tools to prevent influenza. So masking is a great way to prevent both COVID and influenza. Washing our hands, a great way to prevent both viruses. Making sure that we stay physically distant from people as we're talking and communicating with them, because even just talking droplets can put out those viruses as we're close to each other. And making sure to cover our coughs and sneezes and just so those basic hygienes are great tools that will prevent both illnesses. But the best way to prevent it is to make sure your community is all immune to the virus and is not passing the virus back and forth to each other. Well, there's only two ways to become immune. One is to get the disease, and the other one is to get vaccinated against the disease. And so we don't want people catching influenza. We don't want people catching COVID. So the tool that we have right now for influenza, and we have every year, and the best tool in our toolkit of preventing infection is the vaccine. So getting vaccinated is going to tremendously help us not have an immune population that can't pass the virus from one person to the next.
You brought up the point of immunity, and you either get it through a vaccine or by getting it. And I think it's important to note that you don't know how your body's going to react if you were to get the flu or COVID-19. So wanting to get it is probably not the greatest tool that you could have in your toolkit, because you don't know what long-term effects it could potentially have on you. So getting that vaccine and talking to your family and friends about getting the vaccine, like you said, is probably the best way to prevent it, which is my next question for you. If I want to talk to my friends and family about the importance of getting a flu shot, they've never gotten one before, but they are willing to get one. They want to get one. They want to learn more. What can I talk to them about, and how do I start that conversation about the importance of it?
You know, I think the best way for us to talk with anybody when they are trying something new is to understand where they are. So first we ought to listen, find out why they haven't gotten the vaccine in the first place. And do they have any specific concerns or worries that if it's something that we have knowledge about, we can share that. But if they have a worry or concern that we don't know what to do, we can send them to their provider and say, look, you know, talk to someone who understands this and can tell you whether it is the right thing for you. So part of it is understanding and talking to them. But then in terms of giving them the information on the importance, there's a lot of great information from the CDC, and they have told us how bad flu really is out in our environment. So I think one of the things that people don't understand is that influenza affects so many people in the US every year, and it causes some really bad outcomes. I mean, we're seeing anywhere from, and it varies by season, but just like 2 seasons ago, 39 to 56 million people became ill with influenza. And we had, in the range of 18 to 26 million visits. Well, by getting vaccinated, we can reduce about 7 million of those visits. Okay. So, so just knowing that, okay, you won't have to go to the doctor for your influenza. There were anywhere from 400 to 700,000 hospitalizations, and we could have prevented 100,000 of those with vaccination. And then deaths, I mean, that is the thing, is people do, and even young people and sadly children. I mean, we have about, I think last year we had about 180 children who died from the influenza, and anywhere from 24 to 62,000 deaths every year, and we could have prevented a good chunk of those as well. So what you see is, first you need to know that it is important to do, both for yourself, but then realizing that we're trying to create an immune community, because if I'm immune, I can't pass it to the next person, and then they can't pass it to the next person. And so we can stop transmission. And you don't know if the person that you're giving it to is going to be one of those individuals who is at high risk for complications. This is something that is kind of interesting, is when we vaccinate, we actually reduce the number of, for people who have cardiac disease, we reduce the number of cardiac events that they have. So their heart failure doesn't get worse. And part of what it is the influenza virus creates inflammatory reactions in your body. So COVID does create an inflammation there in the lungs. And we can get some generalized inflammation from influenza. And so you have we have fewer heart attacks for people who are vaccinated. If a certain person has lung disease like COPD, we prevent hospitalizations from COPD exacerbation if they're vaccinated. They have a much lower rate of hospitalizations afterwards. And even people with diabetes have a lower complication rate from their diabetes if they're vaccinated and don't get the influenza. Influenza makes other diseases worse.
That's really interesting. I didn't know any of that. And it's great to hear that you can take a precaution against one thing that will help you out potentially in the future with other things too. So we've been talking about the importance of the flu shot, what the differences between COVID-19 are and the flu, but how do you actually get a flu shot? It's starting to get a little cold in Utah finally, and I know that kind of signals to go get this flu vaccine. What are some ways that Intermountain is providing access to get those flu shots for people?
Well, so we're just about hitting October this week, and so that means it is time to get your vaccine. And all of our clinics, pharmacies, hospitals, emergency departments are all stocked with flu vaccine. Everybody in the state has ordered more doses this year, knowing how critical it is to have people vaccinated. And because the CDC has asked us, they said, look, for you to have some good immunity, that we're not going to be spreading influenza around, we can shut down influenza spread, we need about 60 to 65% of your population to be vaccinated. And right now, you've only been doing about 40%. So we're looking at hundreds of thousands of people. I mean, we have something like 600,000 people more than we ever do. We've got to get vaccinated. And so we brought as much vaccine as we could possibly get here into Utah. And we have a lot of opportunities now for people to go and get it. So just if you have a scheduled visit in your clinic, get your flu vaccine during your scheduled visit. You can walk in to one of our pharmacies. So we have our community pharmacies. You can do walk-ins there. There are special events going on. Many of your clinics have extra hours that they have scheduled to just do flu vaccine, or a special time where they will have flu vaccine going on at the same time as clinic visits, just in different parts of the clinic. We have drive-up events every Saturday at most of our community pharmacies so that people can just drive up. Our pharmacists can give you the flu vaccine. It's an easy process and a safe process too. So in order to find those events, you just need to go to, we have a special influenza website, a flu website at intermountainhealthcare.org. And when you go to our website, you can look up by facility that's near you. It'll have the map, it'll have under that facility, it'll show you what hours these special clinics are going to be, or these drive-up events are going to be. And so it's a nice way for you to actually have this interactive map that you can look and say, where is it I can go get my flu shot and what are the hours that they have?
And what's the best time to get a flu shot? Like, when should I make sure I have my flu shot by if I'm trying to protect myself the most as well?
So we, it's any time during the flu season, but we really emphasize we want it before flu starts circulating a lot. So right now we don't have very many cases out there. It's a low number. So we want you to do it now so that your body is already fully protected for those times when we see it happening. The times we see the most are after everybody gets together. So those gatherings like Thanksgiving and Christmas, we tend to have big spikes of influenza right after those types of gathering times, just like we've seen with COVID right after 4th of July and right after Labor Day, when people all get together, that's when we see big spikes of virus that's been spreading around. So I think everybody's kind of learning how to be epidemiologists here. They're learning so much about COVID, they're going to understand a lot about other respiratory viruses like influenza. And one thing I do want to emphasize is that it's not just a shot. I did mention that it was the flu shot, but there's the flu vaccine you can get either in the nose flu mist, or you can get shots. And anybody can get those vaccines after they're age 6 months. But there is also a high dose vaccine for people who are over age 65. And the reason for that is, as just like you said, as you get older, all parts of you get older, including your immune system. And so you need that added boost of extra antigen within the vaccine to help really teach your body, hey, you need to turn on and make the antibodies you need to protect yourself.
You answered my question. I was going to ask you about the high dose vaccine. We had a few people ask us if those were available. Do you know if those are available in every situation that someone can get the flu shot? So the walk-in pharmacies, your appointment, the drive-up, are they available everywhere for that?
Yes. So everywhere within our system that is providing flu vaccine, except maybe our pediatric practices, which don't have patients over 65, they should have the high dose flu vaccine. And then if they want to get the mist, that's highly available as well. And that's for people who are ages 2 years to 49 years is the approved group for that vaccine.
And you mentioned pediatrics too. I know that a lot of our pediatricians are also kind of doing this 2-for-1 situation where if your child has an annual, you can also get vaccinated at the same time. So make sure you check with that if your child does happen to have an appointment. I think that's an easy, simple solution and kind of gets you in and out pretty quickly as well, which is nice.
Yeah, and we have had kind of restrictions on visitors, but now we can have the one person coming with your pediatric patient. And if you call the pediatric office before and schedule up other individuals who want to get a flu vaccine with you, you can bring other individuals with you to those clinics as long as the clinic knows they're coming and has them scheduled to get their flu vaccine. So so on that regular pediatric visit, they will get others taken care of as well. They just need to be informed ahead of time.
That's great for families, working parents. It kind of allows you to have that one and done, which is nice. So last question for you. How much does the flu shot cost, and how do I learn more information about the flu shot in general as well?
Well, it's great we were talking about pediatrics because I do want to emphasize some information specific to kids and getting them the vaccine they need. But in general, if you have insurance, every insurance should pay completely for a flu vaccine. Okay, so that's the one thing that through the ACA Act, if it's a preventive service, And so your insurance should pay 100% for a flu vaccine. We have individuals though that are either on Medicaid or uninsured, and that's for children. The government has a program. It's called VFC, or Vaccines for Children. So children all the way through age 18 years can get free vaccine at VFC approved sites. So most pediatric clinics, some pharmacies, and other community groups like your community nursing services, your public health departments. So if you go to a local health department, all of these groups are VFC approved sites. And so you just need to check and make sure that where you're going has the VFC, and then your child can get free vaccine if you're on Medicaid or uninsured. Okay, so that's a great option. For uninsured adults, what we really want to make sure that they understand is that there are low cost options out there for them. So they can go to, they should be doing a little bit of shopping around and say, I'm a self-pay patient. And they can go to local pharmacies, and most local pharmacies have self-pay discounts. So they got to be talking to the local pharmacies. And then the other places are, again, a community health center, a local health department, and our community nursing services, which tends to go to some of those school-based campaigns and events. If you see CNS or community nursing services, all of those groups have low-cost options.
And I know that we, like you mentioned earlier, have a website where people can look to for resources. Just so everyone knows, that website is intermountainhealthcare.org/flu, and we'll post that afterwards for you guys to look through. But is there anything else that you wanted to mention to us today about the flu vaccine or anything related to vaccines in general?
Yeah, I think, I think it was, as you were asking, how we talk to our friends and family who may not be sure whether the flu vaccine is something that they want to do. I think a big piece is for us to talk about our confidence in vaccine, the experiences we've had, how vaccines, I can personally say I have seen vaccines to be life-saving. I've taken care of patients who haven't been vaccinated, who've died from vaccine preventable diseases. And it's tragic. And it's something that has stuck with me for my life. I have a daughter who, before she was old enough to get vaccinated, was life flighted and in an ICU for a week because of the pertussis, whooping cough. And we almost lost her. 4 other children in her community died from it during that outbreak. And so we feel very, very fortunate having, being able to still love and see our daughter. We were lucky, and but others have not been. And so vaccines are something that our parents were desperately anxious to have for us. And as the new vaccines came out, it was life-changing for individuals. And I think it's something that we realize as well, is when there's an infectious disease passing around that we can't control, our work is to try and find something that will help control it in a safe way. And so vaccines is the things that is the technology we found that has changed our world. And so I would encourage you, we have a great vaccine for a respiratory illness, and that's influenza. And we will be watching to see how things go in terms of developing a safe and effective vaccine for COVID-19. And we are hoping that in following those same processes we follow for other vaccines, we can find and have one developed so that we will have more freedom again once we can become immune from the COVID as well.
That was a really great story. Thank you for sharing that with us. I really appreciate it. And thank you for sharing all of this information. I think it's super important for the community. Flu season is just starting, so we'll be pushing out even more information for people to look for. But if you guys have any questions around the flu, like I mentioned, we do have a website. I will post that in the comments afterwards for you guys to look at. You can also contact your provider and ask them any questions you may have as well. If you have any questions specific to COVID-19, our hotline is still available. That phone number is 844-442-5224. We do also have our emotional health relief hotline available as well, 7 days a week from 10 a.m. to 10 p.m. That phone number is 442-2211. Tamara, thank you so much for joining us. We really appreciate the time, and we'll chat with you later.
It's been a pleasure, Amanda. Thank you so much.
Thanks.